Now let's do the axial skeleton. That's not too bad. Finish this up. So that's the bones that make up the trunk, the spinal column with the rib cage. Looking at the spine, we find the top neck portion, a midsection, and a low back area. Can you give the anatomical terms for these three regions? Cervical, say, scapular? No, yes? No, right? So what we call this section then? The cervical is up here. What we call this section? Thoracic. And what about the other one? Lumbar. Good. Thoracic, so cervical, thoracic, lumbar. Thoracic is where the ribs attach. Cervical is the neck, thoracic is where the ribs attach. And lumbar is below the ribs to the hip. Looking at the spine from the side helps us make up three distinct curves. Well, at least we should have them. The midsection bends back, and the top or the bottom bend forward. So when you look at the curves, the top goes like that. The mid goes back like like that. The perf goes backwards, and then the lumbar goes forward again, unless you have a flat back, but it still goes forward. And so from the side, you kind of accentuatedly look like that. You go this way in the spine, so that's forward bending, backward bending, forward bending, and then down in the hip, you go actually backward again. It's just the whole bone. It's not movable bones. All right, so that's. Let's see here. So the primary curves are described the ones the baby develops in the womb. So that baby in the womb is like that. So everything is down like that. So every curve is like the primary curve. That's the primary curve up here, and then here's a primary curve. The other ones are secondary curves. They form when the baby holds up the head. You know when a baby come out, you hold the head, right? It does not hold its own head yet. So do not flop that head. And then so when it starts holding the head up, that's when we develop the neck curve, and when it starts walking, we develop the low back curve. That's also, I don't think we want to get the baby walking sooner than the baby wants to walk. And if the mom can and the dad can't handle because their kid don't walk by 3 months, well, too bad. All right, what apply? Choose all that apply. Secondary curves. What are the secondary curves? Anybody over here? Is it the sacral curve or secondary curve? Which ones? Cervical and what? And lumbar. Those develop later on, not in utero. So they are secondary curves. Let's look at that. Seems like it's a little confusing. I don't get too many people answering me here. You guys did the quiz, right? Good. So, primary curves, secondary curves. Very easy there. And then that's the cervical spine, the cervical section, thoracic section, lumbar section. There's a whole bunch of different names. There's a first lumbar vertebra, and then here we also have a name for the disc. In between the bones we have these discs. But what I also want you to pick up with this, I like this picture because it's integrating a few things. So if you don't understand all of it on it, it's all right. We can work on it. And it comes back. But a cervical curve, it's a secondary curve, and it goes this way, so it moves forward, it bends forward, and they call that a concave curvature. They also, have you heard of the word lordosis yet? They also call that rounding a lordosis. It's the same down here. That's the same rounding. These are lordoses. When you have a car accident, you know a car accident, right? Those. Somebody smacks you from the back. Oops. Sorry about that. Somebody smacks you from the back, and you don't pay attention to it. You don't notice it, and your neck goes like that. Right? And actually, the hardest thing they figured that out. They did some 20-year-old people on chairs, and the chair had a headrest, and then they came from behind and slapped them like it's a small car accident, and see how the neck goes. So if the head was on the headrest, the head will go back and forward fairly all right. if the head was forward violently, but if we were talking a small car accident, if the head is not on the headrest, the distance from the head in free flow to the back is what made the damage. So when the head bangs back like that, these ligaments in the front, they break. And long term, what you're going to get is you're going to get a neck curve that decreases and gets stiffer and stiffer and more straight and straight. The looking down is the same thing. The amount of patients I have now, they're all tied up here from looking down the whole time is amazing. I know, being in here is not helpful. You're looking down and reading books. It's not just the telephone. But the telephone doesn't help. So those curves are lordosis. The secondary curves. The primary curves are, oh, they don't have the word here. They're called kyphosis. Why the heck? Let me write that down. Kyphosis. You might as well have that word somewhere. So lordosis versus kyphosis. So that's probably about where I'm going to leave that discussion. And the rest you pick up later. All the vertebrae, except for the very top one, are pretty much alike. They all have a centerpiece called the body, two pillars sticking up that form an arch. In us, the arch actually forms towards the back, posteriorly. The bumps you feel in the back, outermost tips of these vertebral arches, the spinal cord runs through the channel that is formed by these stacking the vertebrae, blah, 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 on top of one another. Can you name the four main pieces that make up the vertebral arch? They're all there.
Oh yeah, that's what I can see. Yeah. I answered that and they said I got it wrong.
Oh yeah, you know why? My question is a bad question. Because you have two pedicles and two laminas. So the answer is pedicle and laminas. The answer, but I got to change that. So that I got to help me remember and break that. I'll give everybody a point on that question. What number question is that? So let's look at that. So when we see, let me explain myself. Maybe that will help. When we see this is the vertebral column, the whole thing. This here is one of these bones. You got that? All right. And so here is one of these bones. You got one of these? Did you get one of these on the table? Good. So when you look at this thing, the way it is here is like that. On the bottom, the big thing is the body. That's a good word for that. We don't even have to study that too hard. We're going to know that. Body, vertebral body. And then these two things sticking out are the pedicles. Right here. Pedicle here, pedicle here. And then we have stuff on the side, sticking out on the side. We call that the transverse process. And then from there, and we got a bunch of joints coming together here that stack on top of one another. If you look at it from the side, you can sort of see it. Here where these bumps are on the side, in the back you have these joints that form vertebra to vertebra. And so that's also part of that gestalt on the side here. But then from there, you're gonna go back towards the back, and that's called the lamina. And then where the lamina comes together, it's called the spinous process. That's the stuff you can feel in the back. That's the spinous. If this doesn't form, they call that spinal bifida. That's a spinal bifida. It doesn't have to be bad, but it can be bad. If you have multiple segments where this back stuff doesn't grow, then the spinal cord might come back out. And then you got a nervous system right here, right? And it's not going to be that great. So that's a challenge with that. And so the vertebral arch is this arch. So the way it technically it's bordered, well, the spine, the way they talk about it is the pedicle and the lamina form the vertebral arch on both sides. So I'm going to change that question. Does that make sense? Now that you know what I meant? Uh-oh, I'm making you fall asleep. Huh? I know. So that's for that. So then when we go to the top vertebra is a ring. Look at that. You'll see a ring, and the ring is balancing our head. It's named after the Greek god that carries the world on his head. Can you name it? Atlas. You got that? That's the Atlas. The Greek god holding it up is the Atlas. Now, the second vertebra is also unique because evolutionarily, when you look at this vertebra and this vertebra, this one has a body. This one doesn't have a body. It's just a ring. This is this body thing in the middle. What happened to the body? And evolutionarily speaking, the body got absorbed. Hey, quiet. The body got absorbed into the second vertebra. You can talk outside. Into the second vertebra. The body from C1. And now you got this peg thing sticking up through the body of C1. And what happens is, that's where we can do a lot of rotation. So a lot of this, 50% of this actually, comes right from up here because those vertebrae can rotate around one another. You see it on this one too. It just does a lot of red stuff. Those are blood vessels. Up here you can see how it can rotate. And it's because that peg sticks up in the middle. And then what the body does, it's going to make very strong ligaments right behind that thing. So it's very stable. So all it can do is rotate. Yeah, you don't want that to go this way. That will kill you. The core goes through here and then that thing will just squish it. That's where Downs kids have a weak one of these potentially. That's why when Downs kid plays soccer and head, I'm like, oh no, please don't. You know, that's when I get freaked out. Also, rheumatoid arthritis can weaken this ligament too. That's very important to know that if somebody has RA and does, you know, sports that have impact like that. Because that could be a potential weakness. So what is that thing called? The peg. The dent. Good. The dent is the verb we use. They also use odontoid process. If you look it up in a booklet, it probably shows there too. I'm not sure. Let's see. Atlas. No, it just says dents. Dents, that's good. Another word they use for that is odontoid process. Odontoid process. So if you see that, it's an AKA, also known as, for that. An AKA. You know AKA means, right? Good. All right, let's go to the next one. There are two features unique to the other cervical vertebra. What are they? Or to all cervical vertebrae? Can you identify them? Anybody? Transverse foramen? It's transverse foramina and bifid spinous process. So the hole on the side is the foramen. A hole is a foramen. So in the neck, when you look at the blood supply for the brain, you're gonna have the internal carotid coming up here, going into the, and then you got the vertebral artery coming through the cervical spine up through the vertebra, and then from there it reaches into the skull and it feeds the back of the brain. And so that vertebral artery needs to have a hole to go through, and that's the transverse foramen because it's in the transverse process. So when you see a vertebra that has a hole on the side, you know it's from the neck. Like this one too. There's a hole on the side, you know it's from the neck. The other thing you know is from the neck, besides it being small, is when the back piece, the spinous, splits. Like you see it here pretty well. It splits and goes to, like a fork. From one it goes to two pieces. And what happens is when you bend your neck backwards, the vertebrae need to lay on top of one another, the spinous process. They can't jam into one another. And so if you got the top one have these two forks, it goes over the other one and it can kind of go a little bit further back. So that's why you got these bifid spinous processes. There you go, you got that. Let's see, the midsection is the thoracic spine. Those vertebrae have areas for the ribs to attach. What are, can you name them? Anybody? Costal facet on the ribs. Yeah. And then the other one? The facets of the transverse process. Good. So in a rib, when you look at the midsection, let's find the midsection. Come on. When you look at the midsection, you got all the ribs attached. And the ribs go basically around under the shoulder blade, under the armpit, from the back to the front. In the front, you got them connected to the sternum. We'll talk about that in a minute. In the back, they come in and they have a little bit of a bump. They have this transverse process on the vertebra. And then if you look on the inside, and you're going to get those also to look at. There's 3 altogether. When you look on the inside, they attach to the bones, the body of the vertebra in the front as well. So when you see the ribs coming in, when you have just the vertebra here, that's the thoracic vertebra. They come in here, they attach here, they touch here, and then they go under the body and they touch down here and up here. They go in between 2 bodies. And so the transverse process facet is this little indentation on the thoracic vertebra. On a plastic thing, it just looks like it's a little gruff. On a real bony vertebra, you see it much more distinct. And then the costal facets for the ribs are these ones that are on top one and on the bottom one. Sometimes they call them costal demi-facets. Demi means half, because there's a little bit on the top and a little bit on the bottom. All right? So that's the ribs. But so that section doesn't move as much. It moves, it's a little more stiff. And the ribs are protecting the lungs also, right? You got that? What you notice most about the lumbar vertebra? Big one. So it's big. Big. That's definitely on it. The large vertebra. What else is on the lumbar vertebra that you picked up? The spade-like. So in the back, when you look, this is not the greatest example, but it's wider than like the neck. The neck vertebra splits. That's the bifid. The thoracic goes down. It's like long and slender. If you can see it here, it's long and slender, and down in here it gets bigger and fatter. So everything gets bigger. Good. So that's for that. Yeah, see the picture of the rib here, how the rib goes into the vertebra, how it goes from the front to the back, and here's the body. It attaches on the body and it attaches on the spine. I mean on the transverse. So you can see that there. Good, that brings us to the sacrum. My favorite bone, so you gotta make sure you know that, it's on the test, it is my favorite bone. I just played it. Huh? That's right. At the bottom of the spine, we have structures made of multiple fused vertebrae. What is it called? Oh, I gave you the answer. That's right. It took me a moment to get that. Sacrum comes from the word sacred. And in Greek mythology, they apparently used animal sacra because they have this plate-like thing, the way you can, so they use it to burn stuff on. Use bones for stuff like that. And so that's why it's their sacred bone. And it's a very nice bone. On that bone, what is the left of the spinous process forms, on that bone, what is left of the spinous processes that forms a ridge structure going up and down? Medial sacral crest. So if you feel yourself in the back, there's bumps. The ones in the middle, right here, that's the median sacral crest. When you look at here, we have the sacrum from the back, that's that crest, fused vertebrae. When we flip it around in the front, we see these lines that are the transverse ridges, and they are fused intervertebral discs. We did not really talk much about the disc, but on each vertebra, and between each vertebra, we got an intervertebral disc. Inter means in between, vertebral between vertebrae. And that is actually a great place for irritation because it has pain fibers in it. However, I got a disc herniation in the back, a slip disc, and I need surgery. That's not what we need to do anymore. That's old school stuff that there's many more better things to do until we have to go to that place. Sometimes you do, but be very careful if somebody just wants to call you on your back. Before anybody want to call, just unless it's very clear, but musculoskeletal, call me up and we talk about it. You might have to, but you want to be gentle about it and not overzealous of choosing that as an option. So those are the transverse ridges. And then here, last but not least, I think, with that, we come to the rib cage. In front of just the breastbone. What is the anatomical name? Sternum. Good. So you got these on your table. And the chest plate is the sternum. So this plate here, that's the sternum. We got the tip at the bottom. That's the xiphoid process, which I want you to know. That is very delicate. So when you have it, it's right here under the ribs if you come into the side. And don't poke too heavy. It's mostly cartilage, it's laginous, and it can be very sharp. And this is why when they do the Heimlich maneuver, when somebody chokes, you want to make sure you go more or less by the belly button up. You don't go too far high up because you don't want to break it off. Then we also so that's the xiphoid process. Then the middle portion is just the body. That's a good name to use for stuff like that. And then on top you got the manubrium. So there's 3 pieces to the sternum really. And the manubrium is where you have the first rib attached, and then also you got the collarbone go right in here. The collarbone is part of the extremity, so we'll talk about that on Wednesday. But that goes right in. That's the only joint. Think about it. That's the only joint right here where the whole arm and scapula, shoulder blade, is attached to the trunk. Everything else is muscle. All this from here, shoulder blade to the trunk, is all muscular, except for this one joint here. So that's pretty interesting. And people break this bone, the most frequently broken bone in kids, well, maybe not anymore now because they don't go play outside, but if they do, because we fall on the arm like that, and then that's how we break it. So it cracks. The force goes right into the arm, and then it clicks right here because it's very... In cats, this bone is in... The clavicle is in the skin. It's called a dermal bone. It's a very flat bone. Well, I think we have some when we do the extremities. So that's the manubrium on top, and then down in here we have all these ribs that come in. When they come in to the front, then they have cartilage, and then the front piece, the cartilage goes from the out here to the sternum. So there's a little bit of give, a little flexibility. So it's a chondral joint. It's actually a place where I do a lot of work on patients because if you have carpal tunnel or anything like that in the arm, or you have neck pain and it's really stiff in here, all these muscles go and attach to the shoulder, to the ribs. And if you use your arm a lot and the arm is attached to the shoulder blade, and then the shoulder blade anchors to the rib cage, and you're yanking on that, you're going to yank on the ribs. And then this gets weird out, and sometimes then it's painful here a little bit when you push on it, or underneath you feel railroad tracks because the ribs spread out a little bit like that. And then these muscles get really stiff. Or sometimes you see people's SCM, this front muscle, you see it sticking out like that in the pretty lady photographs. You see they go like, he must have neck pain. Something's not that good, you know. You start looking at that kind of stuff more. But I often take a patient, I go underneath the armpit and I push down on a drop table, or I take a little instrument that I have if it's an older patient or or a young patient or very sensitive, and I go like that and I tap it. And then that pushes it in, and that releases these muscles. And it can release carpal tunnel too, because the nerves go through here, and then they feed into here, and then all that gets tingling. So before you do carpal, these days they're good at that, but in the old days they have carpal tunnel, let's open it. Like, you know, that's like, what are you going to do with that? And then in carpal tunnel, there's a ligament that goes around the carpals holding everything together, and there's crowding in there. The muscles move a lot, and the nerve in there gets squeezed, and then it gets tingly. They cut it open to make room, but you lose function that way. So these are things we got to think through a little bit, and so they don't do that as much anymore. Once in a while, and so once in a while it's a good solution, but it's not a solution for all the symptoms down there. With the ribs, so that's how I do rib stuff a little bit. With the ribs, we have true ribs, we have false ribs, we have free floating ribs. The true ribs are 1 through 7. If you look at them, they all attach directly with the cartilage to the sternum. If you do the false ribs, they don't directly attach, they use the 7th rib to attach into it on the cartilage. So they become false ribs. And then on the bottom you have 2 ribs, they don't attach to nothing. They'll call them free-floating ribs. The free float. Yeah, if you massage, you don't poke in like that too heavy because you poke them. I mean, I had a lady, think about this, I had a lady with bad scoliosis in the office. That was about 10 years ago now. Really cool lady. And she was in her early 80s. And so scoliosis is this curvature. So she was so curved on one side that she had a pain when she was walking. And we figured out her rib was touching the hip. And that would cause the pain. So straightening her out was helping, and it was helping for a little bit, and then it came back. No, I think that one actually stayed at some point. It stayed better. But that's one place, and they didn't find it out. That's one place where you have to, if you know the anatomy and you think a little bit, you can come up with a lot of things in the musculoskeletal arena that you can actually at least think through as in helping. All right, good. That's the rib. We don't need to worry about that. Good, that's all I got.
I have a question.
Yes.
I heard those Lordosis are the one that women remove surgically
Yo, don't even do that.
to train the waistline. They say we don't need those.
You don't need those ribs? Well, who said? You don't need everything. I know, no. I mean, that is, I think that if I can convey all the different pieces of anatomy that work together, what I hope to convey is that can be very dangerous. You're taking out, a lot of stuff, a lot of meat, just for that little waist, and then, you're a Barbie doll until 40, and then, never mind. No, I think I wouldn't do that. I had a guy come in, he's like, hey, Chris, what do you think about putting fake muscle in my thighs in the calf? I'm like, you gonna talk to me like that? Go to the gym. He was like, nice, you wanted to look pretty. But anyway, any other questions?